Welcome, everybody, to the Coronavirus Preparedness for People with Chronic Diseases. My name is Mark Booten, and I'm the CEO of the National Health Council. For those of you who are not familiar with the National Health Council, the organization was created by patient organizations 100 years ago for patient organizations. And you can see here many patient organizations who are members of the National Health Council, and they include a wide range of groups representing a variety of different diseases and disabilities. The organization is somewhat unique in that while the National Health Council is governed by the patient organizations, we have representatives from all stakeholders in membership, including the biopharmaceutical, device, diagnostic, insurer, payer, provider, family caregiving, and research communities. We work on systemic issues that are important to all people with chronic conditions and advocate to drive innovation for better treatments and better delivery systems for people with chronic conditions. And we also work for affordable, meaningful access for people with chronic conditions. As we're all aware, COVID-19 is causing significant concerns globally. This has become an extremely fluid situation, and there are likely to be ongoing changes and new impacts and information emerging daily. To help the National Health Council members manage the situation and communicate more effectively about COVID-19, we launched a new website today. It includes links to resources and provides staff member contact and additional information. We are also starting a weekly members-only web-based meeting for CEOs and other senior staff of the National Health Council, patient groups, and nonprofit members to share what they are doing and their innovative efforts to overcome challenges posed by COVID-19, including innovations and technologies and approaches being used to fund and raise and replace canceled events. In addition, looking at new ways to advocate for policies regarding financial relief for nonprofits, and with the hopes of those being included in any proposals that might help provide relief to the larger economy. We invite all CEOs and other senior staff to participate in these efforts. I want to thank you all again for joining this webinar. Our guest speakers will discuss the ways patient groups can assist their members and other constituents in reducing the impact of COVID-19, including how patients with chronic diseases can avoid the illness, what to do if they feel sick, and how patient groups can prepare to field inquiries from their members. Next slide. We are presenting our understanding of the most current information as of today, March 13th. If you have any media inquiries, please direct them to Jennifer Shellman, the National Health Council's Assistant Vice President of Marketing and Communications. We can go to the next slide. I've already reminded you to please keep yourselves on mute, and I hear that the echo has gone away, so I thank those of you who had done that. We will be taking questions at the end, and you'll be able to submit those questions via a chat function at the bottom of your screen. And now I'd like to introduce our speakers for today, Dr. Albert Rizzo and Dr. Stacie Bell. As Chief Medical Officer of the American Lung Association, Dr. Albert Rizzo is the organization's senior medical authority. Dr. Rizzo has long been a key medical advisor to the American Lung Association, a member of the Lung Cancer Expert Medical Advisory Panel, and a leading media spokesperson for the association. Dr. Rizzo is also chief of the section of pulmonary and critical care medicine at the Christiana Care Health System in Newark, Delaware, and a member of Christiana Care Pulmonary Associates. Dr. Stacie Bell serves as the Chief Scientific and Medical Officer for the National Psoriasis Foundation. Dr. Bell has 25 years of diverse experience in drug, biologic, medical device research, education, strategy, and product development. She's been involved with most phases and functional lines of the clinical development process. We are now going to begin with a presentation from Dr. Rizzo. Dr. Rizzo, I'd like to turn it over to you.
Thank you, Mark. And thank you all for taking the time to be here and for the opportunity to help out. We can go to the next slide, please. So the COVID-19 certainly is at the top of mind these days, and has been around for the last couple of months coming out of China. And this is one of the coronaviruses. We had about 4 of them that were normal coronaviruses that caused a common cold that we all got used to. And then we had SARS and MERS, 2 other coronaviruses that occurred earlier in the last 10 to 15 years. But this newest coronavirus called COV-2 and COVID-19 is the actual disease process. It's felt to spread between people, unfortunately, fairly easier than we first thought. Certainly close contact and droplets coming out of coughs and sneezes seem to be the main route that it spreads from individual to individual. Common symptoms include fevers, cough, shortness of breath, or trouble breathing. And currently, information suggests that about a 2 to 14-day window exists between when a person might be exposed and infected by the virus and symptoms develop. That's why you might hear the 14-day quarantine period being used. It's felt that if no symptoms develop during that 14 days after contact, the chances are that person is not developing the disease and is therefore not infectious. Unfortunately, we also know now that very mild disease can occur, and individuals may have the virus and not know that they have it. So that's why spread has become a bit more frequent. Next slide, please. And that is what prompted the World Health Organization to, I believe just yesterday, announce that this is a pandemic. And we've had other pandemics in the past, mainly through influenza, another virus, about 4 of them, I think, in the last century or so. Pandemic doesn't necessarily mention the severity. It mainly says that it's been spread easily from person to person and spreading from country to country and basically becoming a worldwide infection. That is what's also prompted a lot of what we'll talk about today, from a containment strategy, which is what China and many countries did initially, trying to isolate individuals, tracking down their contacts, and keeping the spread from occurring. However, because spread has occurred despite those containment efforts, it now has been moved to what we're going to call a mitigation phase. This map shows how widespread the infection has been. Next slide, please. If we look at the United States, and again, this is as of March 12th, as of yesterday, there are hotspots that you see up in Washington, California, New York. More and more states. In my state of Delaware had no episodes up until earlier this week. And now I know we're up to about 4 to 8 being investigated in our state. So the assumption is, and the reality is, that it's going to spread and more individuals will become infected. Initially, it was thought to be due to where people travel. It was thought to be due to who they came in contact with. Unfortunately, now that can't be the only way individuals get exposed. Many of the cases being identified now, there's no specific source or contact that can be identified in those individuals. Next slide, please. We're noticing, unfortunately, that this infection is taking its toll a bit more on the elderly. The pattern of disease process that was noted in China indicated there were some cases that were very quickly Devastating. Individuals succumbed fairly quickly after a few days. Other individuals stabilized a bit, but then went on to die from complications of the virus, very similar to what influenza can do. Unfortunately, that means that the elderly and those with chronic diseases tend to be at more risk. And some of the studies coming out of China show that the fatality rate for individuals over 80 is much higher than those over 60 and is higher than those over 40 years of age. So age certainly is a risk factor for not necessarily developing the disease, but a risk factor for having complications and more severe outcomes if the disease is contracted. This is a population that we want to specifically make efforts to limit their ability to get infected, limit their exposure risks, and certainly have them be prepared for whatever may occur if they get infected and try to help support them the best we can. Next slide. And this is where we talk about the containment versus mitigation. What it's basically saying is that the horse has left the barn or the cat's out of the bag. We no longer can contain the infection by just isolating those who have been known to have the infection. It is becoming endemic and now pandemic in our community. And for those reasons, you've noted steps earlier this week and just the last few days that have included eliminating large gatherings, canceling the NCAA March Madness, canceling pro sport events. That is to eliminate the risk of more and more individuals getting infected more rapidly. We go to the next slide. Earlier this week, Dr. Fauci talked about this at a congressional hearing. He didn't pull any punches. He pretty much stated, as I've been stating, that more and more individuals will be infected, more communities will see spread throughout their communities. And really the important measures now, we have to continue with many preventative processes that we have in place, the containment as best we can of known cases. Now we've also moved on to the mitigation phase. As I mentioned, the containment phase was identifying the patients who were positive, isolating them or quarantining them for that 14 days, and trying to track down their contacts who would then be self-quarantined. Containment's only effective once we keep things under control, but we are past that phase. Next slide. The reason to help eliminate or minimize the rapid spread of this, I will show you on the next couple slides, but what we mean by mitigation is eliminating the risk of more and more people getting infected quickly. Social distancing is one term for this, canceling of events that I mentioned, closing of schools, and more working from home, remote working, trying to prevent individuals coming into contact with other individuals who may or may not knowingly have the virus in their system, and when they cough or sneeze, that virus is expelled into the air. Studies are now showing that that virus seems to stay alive in the air, possibly up to several hours. It may stay alive on surfaces for that length of time as well. Most of the transmission seems to be the droplets and inhaling the viral particles. No specific evidence has shown that touching a surface that has droplets on it has led to contamination or infection, but we need to be cautious that may be the case. There's still a lot we don't know about this virus because it is new compared to something like influenza, which has been around for a while. We'll talk more about that. Next slide. This is the main reason that mitigation is so important. What you see on that left y-axis is the number of cases. Then across the bottom is the time from the first incident. When we reach a stage where containment is no longer being effective, more and more individuals get infected and more of the potentially serious and lethal infections occur. That's the population that starts to demand the needs of our healthcare system, the emergency rooms, the hospitals, the intensive care units. Without mitigating this process, there will be an acute influx of more and more sick people that will basically overrun our capacity to handle it. You see that dotted line across there? That healthcare system capacity is the main concern that Dr. Fauci had when he spoke to Congress earlier this week. By slowing down the number of individuals who get infected We allow the healthcare system to keep pace with the needs of those infected. If capacity is overrun, and that includes not having enough hospital beds, it includes not having enough protective equipment, it includes not having enough supportive medications like intravenous and oxygen. That means individuals who might have survived with those kinds of support may not be able to survive. We don't want the sick individuals not being able to get access to care because there's just too many of them. That's why it's so important to follow a mitigation strategy, and that's why we've seen some major events taking place this week to eliminate large gatherings of individuals. Next slide. Young children, for reasons we don't know, seem to be fairly, I won't say immune, but they don't seem to be affected by this virus nearly as much as the older and more chronically ill. But that doesn't mean they can't carry the virus, and they certainly can bring it home to their parents, and they can spread it to other individuals as well. So social distancing and closing of schools becomes important in this phase of mitigation. We're trying to limit the rapid spread of this virus. Next slide. Let's talk about personal prevention. Next slide. You've probably heard and seen something like this on many newspaper ads, social media feeds. But the main ways to prevent getting a virus, and this applies to influenza and has been around for years and years and years as a strategy, but we're emphasizing it even more now. Washing up your hands with soap and water regularly, avoiding contact with individuals who are sick, touching your eyes, nose, or mouth with unwashed hands, because that's the entry points of viruses into our mucous membranes. By all means, if you think you're sick, stay at home until things are sorted out. Cover your cough or sneeze. Next slide. If there's a possibility that you're going to be quarantined, or if you feel like you want to stay away from crowds and not be out in the grocery store or in the pharmacies, start to take plans of stocking up on some of your supplies. Certainly, medications become very important to have on hand. You don't want to run out and have to get out. And certainly ask other individuals to go out if you're in that high-risk group of chronically ill or elderly. Social distancing and avoiding crowds. And certainly this is not a time to go on cruises or non-essential travel. Stay at home and work from home if at all possible. Next slide. This is the Surgeon General Drum Act. I think culturally, something like this may allow us or cause us to change our frequent hugging, the handshaking that takes place. The elbow bump or a wave of the hand may do just as well as far as leading other individuals. So certainly that's something we want to try to follow through on. Next slide. You may see face masks used out in the public. At airports, you often see it, people on airlines. As a general rule of thumb, the CDC does not recommend people who are well from wearing a face mask, mainly because it does not seem to protect the individual from inhaling the small viral particles. It may give them a false sense of security. Masks that filter out these viruses should mainly be worn by the healthcare individuals who are treating sick individuals, and it needs to be fitted properly in order to perform the proper filtering mechanism. Next slide, please. So let's say you have someone you've been in contact with or a family member who has either suspected to have it or does have the disease. What are some steps you need to take? Next slide. These would be the same steps you would take with influenza. You might, this is being mentioned a lot, as influenza unfortunately causes millions of people to be sick every year, hundreds of thousands of hospitalizations, and tens of thousands of deaths every year. And that's despite a vaccine that is fairly effective most years, and despite having antiviral medications that are specific for influenza. The influenza has been around, and unfortunately we have some expectations about influenza that doesn't seem to raise the alarm among the public about flu season. But hopefully that changes, because we need to stay diligent with regard to the typical hand washing and preventive measures that we mentioned before. COVID-19 symptoms, just to go over them again: fever, cough, Shortness of breath are the main ones, but it also can be tiredness, achiness. Tom Hanks was just recently found to be positive. He and his wife had fatigue was one of the symptoms that they presented with. And unfortunately, just like influenza, it can cause a pneumonia. And that's usually what ends up being the reason for more people being in the severe category, ending up in the hospital, and sometimes dying of that pneumonia or complication of the pneumonia. The transmission, like influenza, is from person to person, coughing, sneezing, talking, as I mentioned before. Treatment for COVID-19 currently is what they call supportive. We have no vaccine in place, no antivirals that we know for sure work. There are a number of drugs being looked at, and there's a lot of activity around developing vaccines, but currently nothing is available to definitely treat this infection. Next slide. So if you're sick, don't rush into the ER or go to your doctor's office. Try to contact by way of either telemedicine or a phone call. Describe your symptoms, then get some advice from your physician. Testing may be recommended, but certainly staying home may be recommended if the symptoms are mild. Certainly, if you're sick enough to be hospitalized, that will take place. You need to 911 or get emergency help. The symptoms of breathing difficulties develop, chest discomfort, and certainly a bluish tinge to your face suggests some oxygen problems, which may lead to confusion. Next slide. Currently, office visits may be curtailed. I know in my office, what we're trying to do is trying to screen individuals before they come to the office to make sure they don't have symptoms that might suggest they're developing COVID-19. So keep in touch with your healthcare provider with regard to any appointments you have planned, and you may want to postpone a routine checkup at this point in time. Next slide. I think I'll turn this over to Dr. Bell.
I feel very fortunate that we're all able to get together and try to address this really unprecedented situation. My objective actually in my presentation is to pivot off the very informative presentation provided by Dr. Rizzo and extend the discussion to aspects and considerations of how we best can serve our communities as patient organizations. So whether you're in a leadership role or you serve as a CEO of your organization, you're not only dealing with questions from your patients and other constituents, but also your staff and how we best can be prepared to work together to help the community. Many of the elements I'm going to go through are very straightforward. Some are extensions of things Dr. Rizzo mentioned as far as disease considerations for prevention and in the mitigation phases we are in currently. But I hope that they really prompt a dialogue regarding approaches we can take, again, not only for our patients, but for their families and really, quite frankly, for the providers, because we partner with them and they're some of our best allies in helping our patient communities, but they too are in a state right now of needing guidance. So if you go to the next slide. Again, just elements that I hope to touch on a little bit, really the importance of accurate and timely information. I'll touch on this throughout my slides, and Dr. Rizzo mentioned as well, as did Mark, that our information is really changing on a daily or even an hourly basis. It's unfortunate as well because we do not have as much data as we would like, but we are fortunate to be gathering that very quickly and can hopefully modify our guidances accordingly. I'll touch a little bit on modes of communication. Obviously, many of these things are standard practice for our organizations, but I think it's important to be creative in this time and think about ways that we can modify our modes of communication to be best serving our communities. Also, consulting the experts. We are so fortunate in the United States to have so many fantastic organizations, even like the National Health Council, to pull something like this together. And I think that we have to remember that we're not in this alone. We have a number of individuals and resources we can reach out to, and I think in working on this situation together is really the way we're going to see the best outcomes for our entire community. We also, in consulting the experts, have specific considerations within our chronic disease states. There will be certain things that we will have to consider on a case-by-case basis within our organizations. And I hope to touch on some elements that may help us in that aspect. Again, the common sense guidance. Dr. Rizzo mentioned many of these things have been around for decades. And as influenza became more of a consideration and concern, some elements became common practice. In other cases, not so much. And I think that this situation may modify those things, but it's also taking that common sense guidance and being able, again, to communicate with our community. And then finally, just touching on some resources that we have available. So if you go to the next slide. Thank you very much. So, really, this is an adage that I've followed since I was small. Knowledge is power. Patients feel empowered, providers feel empowered, and also comforted with having some information. As I noted already, our disadvantage at the current time is that some of our data are limited. With that being said, we have expertise, we have a very dedicated focus to help with this health crisis right now, and our knowledge is growing continually. The challenge also is that the more information is out there, accurate or not, it can increase the level of anxiety or fear among our patient community. So having proper information, having it readily available for our community is even more important than on a normal day-to-day basis. Obviously, the benefits, if you've got information for individuals, there's a better awareness, and there's also better care. Individuals are not only taking care of themselves, but working with our providers to make sure that we are mitigating further spread, to make sure those that are needing treatment or needing testing are getting what they do need on a real-time basis. I think that the other thing that we've all heard a lot about in the last months and years is accuracy and fake information, misinformation. We are very fortunate in the current environment that we live in. We have information at our disposal, at our fingertips. Technology has been our greatest ally, but it's also been one of our greatest challenges. So ensuring that the information we're putting out is accurate for our community becomes more and more important. I think that providing the proper guidance will also help avoid escalating any unfounded fears. I think that the more individuals hear stories of mistruths or hear that there are certain things they should or shouldn't be concerned about in the absence of having proper guidance from organizations like ours, the more difficulties and challenges we're going to encounter. Timeliness of the communication, obviously, again, the situation is evolving by the minute, but it's very important for us to try to stay on top of that. And, within the National Psoriasis Foundation, but I think that many of the organizations participating today have, I'm sure, adopted this policy as well. It's really a continuum of communication. We work very hard to try to get some of our initial guidance out, and even days later, there would be things that we could have added to that. And I think the more information we have, that will happen. And I think that the other thing that's very important is that you're the expert for your particular community. So it will be up to you and the leadership that you have to determine the best approaches for your community. There will be certain elements that you'll have to consider that others may not. In the psoriatic disease community, we have a number of individuals on immunosuppressive therapy. Obviously, there's very specific considerations that we may have, and there's things that we need to take into account. And again, the importance of getting feedback from our key opinion leaders in the community and our scientific community as far as what we know about the mechanisms of the coronavirus and how that may fit into our particular therapeutic area. With that being said, if you go to the next slide, please. As patient advocacy organizations, how can we best support our communities? In this age of technology, our reach is phenomenal. We include information in a number of different paths right now on a daily basis to support our community. I'm sure your organizations do email blasts. There are website announcements. Social media has become very, very powerful and has been a tool, a comfort, and again, a challenge for many of the patients in our community, but it's a way that we can really reach individuals very quickly. Materials are always something that we've used. I will say even for the National Psoriasis Foundation, we have had pamphlets in the past. We have fact sheets, many things available in hard copy form at conferences we attend, et cetera. You know, that's challenging in these kinds of situations because the information is evolving so quickly. But there are some basics, especially some of the common sense guidance that we've reviewed today that can be provided in material form. I've also recently heard that there are a number of organizations that have had radio or television announcements. I reside in the Denver, Colorado area, and there definitely have been announcements in both of these venues for you know, patient care and just general practices. I think that the other thing that many organizations use are call-in centers. We are very fortunate at the National Psoriasis Foundation to have our Patient Navigation Center, and I'll touch on this a little further later on in the presentation. But we have highly trained team members that field questions from our constituents. In our current environment, this becomes very challenging because keeping them up to date as far as the information, and as you can imagine, the volume has increased tremendously. I'm sure that applies for anyone on the call as well that fields calls from patients and providers. And so it's also adapting the current resources to ensure that the modes of communication can continue to serve the community. And then also to be creative, you know, going virtual when we can. You know, we as the National Psoriasis Foundation have a number of in-person healthcare provider medical education programs. We also have patient programs. We do a number of our advocacy events in person. So we have had to transition to being very creative about the approaches we may take for that. Likewise, in this case, organizations that may have in-person visits, you know, may go to providers' offices. There may be ways that you have to approach and modify such that you can get the information out there. This also applies for supporting our staff members. You know, I know our focus today is on what we can do for our communities, but really it's keeping our staff engaged and informed as well, and so that they can do their jobs and they can serve their roles for our community. It may be that, you know, moving to virtual work situations, depending on your organizational setup, will be important. And I think these modes of communication will become even more important to support our staff. You go to the next slide, please. Okay, so as I mentioned, you know, it's important to remember that you're not alone in guiding your communities with this. We're very fortunate to have a number of experts assisting us, you know, with our health organizations, with the Centers of Disease Control, and internationally with the World Health Organization, but also organizations or institutes like the National Institute of Allergy and Infectious Disease. Dr. Rizzo touched on the guidance that Dr. Fauci has provided. He has been leading this very, very challenging, difficult situation and navigating all elements of it, you know, with directness, with candor, and I think that that's going to be very important. The NIAID has gotten, you know, they've made a lot of progress to date with basic research, and I think that, you know, addressing the situation from all elements is going to be key. Again, qualified healthcare providers, individuals like Dr. Rizzo, who has experience in, you know, pulmonary disease, thinking about the nature of the coronavirus and how that mechanistically fits into some of our chronic disease states. You know, if you have individuals out there for that. As I mentioned, you know, key opinion leaders in your therapeutic areas. In psoriatic disease, we are so fortunate to have the most incredible dermatologists, rheumatologists, and advanced care providers for our community. As this situation evolved, the key opinion leader community in our therapeutic area has banded together and has really tried to come up with the best approaches for our patient community as a whole. You know, that in our case is really propagated by the fact that we have a very robust and strong medical board and also a scientific advisory board. If your organizations have these types of groups, this is the time to really work with them on a different level, and, you know, having them collaborate in a manner that really provides the greatest benefit to our patients. Also partnering organizations, you know, I'll say even again in the psoriatic disease community, you know, we work very closely with organizations like the International Psoriasis Council. Each organization have their own considerations, their approaches, their focuses, but depending on, or I guess regardless of the therapeutic area and the chronic disease state that you're involved with, there are a number of organizations that can work together to best serve the community. And then finally, really experienced leaders. Again, we're very fortunate, and within my organization, we have a number of leaders that have come from various backgrounds and have years of experience in addressing different situations. Likewise, if we even consider the attendees in this webinar today, we have some of the world's leading experts in patient advocacy organizations. Leverage each other, communicate with each other, partner with each other. If you aren't fortunate to have, the depth within your own organization, I too have been with very small organizations. There are a number of outstanding consultants that can assist as we go through this journey. So if you go to the next slide, please. Okay, so even though they are available, it's important to reiterate some of these basic guidances from your organization. Your community develops a trust within the relationships that you have with them. They want to hear your thoughts on things. And so, yes, you can refer to the CDC. And like in our case, at the National Psoriasis Foundation, our early guidance was really reiterating those recommendations. But again, I think that your community is going to turn to you. So having messages go out about washing hands and not touching your face, and that your eyes and nose and mouth may be points of entry, distancing yourself from those that are sick, the list goes on. That information coming from you is going to make a big difference. Also, going back to our common sense guidelines for overall health, resting, drinking water, maintaining a healthy lifestyle. We don't have data yet, but even risk factors like smoking can contribute to some of the outcomes in cases like this as well. So reminding your constituents that all those things are important in these considerations. In many cases, it's best to refer your patients to their healthcare provider. They can talk to them. In many cases, they know their medical history. If needed, they may order testing, they may see the individual in person, or they may assess the situation if they do need more emergency care. But as an organization, you can outline some of those basic elements as far as communication with their healthcare providers. As the pandemic grows, this may change, and telehealth and virtual appointments may become an integral part of treatment plans. If that's something that your organization has the ability to assist with, it would be something to start thinking about now if you haven't already. More specific guidance becomes an issue, again, specific to each organization. In our organization, again, very early recommendations were if you're experiencing respiratory symptoms or if you have a specific concern, you should consult your healthcare provider. That's really as far as we felt we could go early on. Now we're able to develop a bit more guidance, even knowing how the spread has occurred in the United States. But I think those treatment considerations are going to be based on your therapeutic area. And again, that would be something to leverage all your resources available to be able to provide that guidance to your community. So if we go to the next slide, please. So some of those resources I've touched on already, but our health organization guidelines, patient advocacy organizations as a whole, many have put out guidelines. We've been actively reviewing each release of those guidelines to see how that would potentially impact our guidance to our community. Things like the National Health Council providing even this webinar today and the guidances they put out. Federal and local guidances and requirements, now as more and more state governments and governors are putting out restrictions, whether that be related to travel, large individual gatherings, whatever that may be, make sure that you're aware of those guidances so that when you're putting out information to your community, you're taking those into account. Again, your common sense reminders. I think that in Dr. Rizzo's presentation, he did a nice job having some schematics, having something there to remind individuals in a different manner so that, again, you can touch your community with that. Treatment recommendations if possible. Again, the challenge there is a limited data available, but I do think that even with the data we have now, within your chronic disease state, there may be specific guidelines you can put out. One thing that we run into a great deal, and I'm sure every organization on this call does as well, is we have a number of informed patients and, of course, providers. The provider may not be involved in clinical research. They may not be what they would consider a thought leader, but they want to have further information. And that's where therapeutic area or disease state information is going to be important. The Johns Hopkins website, I think that again provides a very reliable source of information, and that does provide some comfort for the patients to kind of have an understanding of what the situation is. I think also another key piece to think about is lifestyle and employment guidelines. Again, going back to what there may be for state and eventually potentially federal guidelines regarding employment, working from home situations. It may be really beneficial for your organization to provide some of these things to consider for your constituents as well, so that they don't have as much anxiety in thinking about keeping their employment status, which relates back to their ability to maintain their treatment and a variety of other things. If you go to the next slide, please. As I mentioned, at the National Psoriasis Foundation, we're very fortunate to have the Patient Navigation Center. It's really one of the world's first personalized support centers for those dealing with psoriasis and psoriatic arthritis. We have, on-site trained team members that will field questions. We're fortunate to have this ability. I know a number of organizations have reached out and asked about setting up something like this outside this situation, but it may be something that as an organization you want to consider fielding some calls. I will tell you, especially now, as I mentioned, the volume of these calls and inquiries is growing dramatically, so it is something to take very seriously if you would make that step. But I'm happy to address any questions regarding this and put you in touch with our team leaders for this. But it's been tremendous for our community, and in situations like this, it really provides a level of confidence within the community that our organization can be available for them in this context. Okay, if you go to the next slide, please. So the last thing that I wanted to touch on is, again, this situation has evolved so dramatically over the past weeks. But early on, there was a statement where, don't worry, especially if you are younger, especially if you're healthy. Again, many of our constituents, they do not fall into that category with facing a chronic disease situation on a daily basis. And also many of our constituents are of the older age demographic. Either way, at this point, I think that, again, Dr. Fauci has stated it well, and this is, quotes taken from two different situations, but, the situation needs to be taken seriously. And the bottom line is it's likely going to get worse. And, that was from his congressional briefing this week. And the bottom line is that's the case. We are now in the mitigation phase, and there is going to be anxiety. There is going to be concern. There is going to be fear. There are also going to be a number of changes for day-to-day routine, from employment situations, disruption for planned travel, whether that be for personal or professional reasons. There are going to be things missed. There's going to be college graduations that may not be able to occur, and those types of things. And change is hard. So I think keeping in mind the messaging to our community with those elements in mind, restrictions and limitations are going to add further angst. So addressing these concerns with the community directly, I think, is going to be key for a service that we can provide as an organization. If you go to the next slide. I think that's it for today. Turn it back to Mark.
So I want to thank you both. I know the entire audience is giving you guys a standing ovation for the incredible content you just presented, as well as your passion for this. We have received a number of questions, and so I'm going to ask as many of these as we can in the next 15 minutes, and I'm going to direct them to one person and ask that you keep your response as concise as you can, so we can get at more questions if possible. And I want to say at the outset, the slides will be posted on our website, and you will be able to watch the webinar by clicking on the appropriate link on our website. First question I'd like to ask, and I'm going to direct this to Dr. Rizzo. we're getting a lot of questions about people who may be infected but not showing symptoms and whether or not they are contagious for other people. Thoughts on that?
Yeah, this is where the issue of accessible testing comes into play, because an example might be where a student comes home, the teacher had suspected disease. Now that student is a contact, and what about her family at home? How far out do you take those contacts? I think the best thing in those situations is to talk to the provider, healthcare provider, get some advice about whether testing should be done. And testing is becoming more and more accessible, even by the hour, by the day. So I would definitely talk to the healthcare provider in that situation.
Thank you. Dr. Bell, a number of questions came through about trying to make decisions on canceling events or conferences and whether or not organizations should be thinking about canceling a conference as far out as July.
So this is where the day-to-day information becomes more and more important. I think that if the trend continues as far as spread within the United States, then looking out farther in advance is going to have to be something that our organizations are doing. But I do think at the present time, it is something where you have to consider what is going into that. You know, for instance, from the National Psoriasis standpoint, we were all supposed to be attending the American Academy of Dermatology meeting in Denver this coming week. It's a very large conference. It has a large international presence. You know, I really commend the board for the American Academy of Dermatology for taking the factors into account for their conference and deciding that at the present time it was time to cancel. You know, from our standpoint, we are trying to go on a case-by-case basis and look at the circumstances involved. We, you know, for example, have our fly-in in Capitol Hill coming up, and we have a number of patient constituents that typically attend that event. You know, out of concern for our patients, not only their physical but emotional health, that is something that we're currently investigating other options, and that's where the creativity piece comes in. So I think it's watching the data, knowing the specific situations, and again, being mindful of the guidance being offered. At this point in time, you know, there are a number of state governments that are saying that they do not want gatherings larger than 250 people. In the state of Colorado, we've already had a number of events canceled because of that local restriction, more so than any federal guidance.
Thank you. Dr. Rizzo, a lot of questions about face masks, availability, understanding the recommendation that if you are in fact diagnosed that you ought to wear one, but what about people with compromised immune systems who are at greater risk? Should they wear a face mask?
Well, that's a very common question, and unfortunately the guidance is that it may not be as protective as one thinks. So it becomes a matter of dealing with the anxiety and the comfort level of that individual to wear a mask. So we don't certainly recommend it as far as our patients are concerned, but we understand why they use it. But the guidance is such that if you're infected and think you're going to expose other people, first of all, stay at home. If you can't stay at home, put a mask on. But just to wear a mask thinking it's protecting you, probably not as good as just staying home and avoiding crowds.
Thank you. Dr. Bell, if you have a chronic illness, does that in and of itself decrease your immune system? And a related question, if you're going in to get tested, does that put you at risk of coming into contact with other people?
So to address the first part of that question, again, it depends on the nature of the chronic condition and chronic illness. When I made the comment within my discussion regarding, you know, knowing your therapeutic area, you know, in certain cases, the chronic condition may impact the immune system. It also may be that it's not necessarily chronic, it's acute situations such as, you know, cancer, and, you know, being on a chemotherapeutic would definitely impact the immune system at that point. So it really depends on the nature of the chronic condition. Again, leveraging the experts in that particular area. You know, I will say in the psoriatic disease community, we have a number of individuals within our community that are on therapies that render some level of immunosuppression, depending on, you know, what type of therapy. some of our newer biologics, it's not as much of a concern. Some of the older oral systemic therapies, it is more of a concern. So it's really knowing the facts and understanding, that landscape as far as your particular chronic disease condition. As far as being exposed to testing, I think this goes back to the information that Dr. Rizzo presented in his portion of the webinar today in relation to, you want to minimize your exposure. So in consult with your healthcare provider, if they feel that you should come in and get tested, or if they feel it's best for you to stay at home, you could, if you go into an office, you could be exposed, and that's where, again, in some states and local communities are actually setting up, drive-by type testing opportunities. And that's another thing that communities should be aware of what may be available for patients in particular areas.
And I know we have organizations talking about virtual fundraising and drive-by donations. So I love that thought on both accounts. Dr. Rizzo, question, how is having COVID-19 different in terms of risk from having influenza or the flu?
Well, first of all, we've had influenza around for a long time, and some partial immunity may occur in our population because the influenza virus, even though it changes every year, there are some similarities, and our immune system may recognize part of it. But we still have to get a vaccination every year to be most helpful. The coronavirus right now seems to be easily as transmitted. It seems to be a little bit more severe, but again, we're early on. We don't know how many mild cases are out there. All we're hearing about are the very sick and those who die. So it may be telling us a story that's not going to be accurate a year from now. More and more people had the virus, but just didn't have any significant symptoms. So it's early on to tell why this is acting as a more aggressive disease than influenza right now, but we have to act as if it is because we don't have vaccines, we don't have good antivirals for it. We need to keep as many people as possible out of hospitals.
Thank you. Dr. Bell, are patients with overactive immune systems part of an at-risk group?
Well, I think that, again, this goes back to what you're referring to as an overactive immune system and what's being done for that particular individual. If they're on a particular treatment to modulate that immune response on a daily basis, then they may be in an at-risk group. So I think it really depends on the specific immune system abnormality that you may be referring to and how it's being mitigated.
Thank you, Dr. Rizzo. A number of questions about how long the virus will live on different surfaces, whether they be hard surfaces or soft surfaces. Any thoughts?
Yeah, that's actually being looked at, and right now it depends on. A lot of viruses have different lengths of time they survive in the air and on surfaces. It does have to do with the type of surface, whether it's cloth versus hard or metal or wood. Also has to do with the temperature of the area that it's in. So there's a lot of variabilities, and the last I've heard, it's still up in the air, but maybe as long as several hours that it might be staying on a surface and staying in the air. But again, we still don't have all the information about that.
And Dr. Bell, a lot of folks are asking how long should they stay at home, especially if they are at risk, and is there any time frame for how long they can expect that they're going to be in some form of self-isolation?
So I sure wish we could answer that. Unfortunately right now, again, it's going to be dependent on the progression and spread of the infection nationwide. Going back to the actual time frames, if there is an exposure involved, then obviously, that 14-day quarantine is very important just because of what we know about the course of the infection at this particular time. The self-isolation element of it, things like school closures and the restrictions on large gatherings and those types of things, really we're not going to know until we have more data from our testing and from the presence and what we see from the severity of the disease.
So curious, Dr. Rizzo, is antibacterial soap helpful or more helpful than regular soap?
Well, the antibacterial soap will not kill the virus, but the most important thing about the soap and water washing is actually clear away the germs as much as possible. You're not killing them, but you're clearing them away. And then disinfectants or the alcohol solutions, that does kill organisms, but it has to be on there a long enough period of time and used regularly. So it's not a matter of one being better than the other. They actually work in concert. You can't need to use soap and water. You just can't put alcohol wipes on there and think you're doing the best job.
Dr. Bell, I know a lot of organizations have canceled conferences and are dealing with trying to get deposits and fees back. Any advice from the perspective of your organization?
Yes, so I think that twofold, one of which is that right now, again, we're dealing with an unprecedented situation in many examples and cases. I think, communicating, going to consultants again from a legal standpoint if you don't have those capabilities in-house. I think that there is a lot of willingness to collaborate. There are also aspects of creativity that come into play here. So perhaps something has to be canceled now, but maybe there can be an extension for credit if need be for a future event. I think the other thing that I would advise, there was a question earlier about cancellation of events, in the middle to late summer. Start looking into those events in advance. Ask or inquire about cancellation policies. Again, creative solutions that there may be able to be utilized in each specific example.
Dr. Rizzo, there were a number of questions earlier about fevers and whether or not it was a sign that the body was trying to kill the virus, or if you didn't have a fever, but yet you were diagnosed with COVID-19, should you heat your body up through being in a hot tub or something like that?
No, I think that fever is just one of the common symptoms that occurs with other viral infections as well. I think influenza. So it's the constellation of the symptoms, the fever, the cough, the shortness of breath, that makes you suspicious and also makes the healthcare provider you talk to suspicious about whether or not somebody where more investigation needs to be done, like a testing or a chest x-ray, things of that nature. So I would not heat yourself up or anything like that. The fever is just one other symptom to use and tell your healthcare provider to help make some further decisions.
So, Dr. Bell, a lot of questions about whether COVID is airborne and how that might get conflated with the emergence of the allergy season and people sneezing and having runny noses.
So the allergy season definitely could confound as far as the amount of sneezes. I'm sure all of us have now been in a public setting and heard someone cough or heard someone sneeze. It goes back to even the commentary Dr. Rizzo made about stigma. There's definitely going to be concerns for that. I think that the two need to be kept, separate in the sense of different causes, different outcomes of those sneezes. But the same applies as far as proper hand washing, distancing, whether an individual you may be in close proximity to has an allergy or has a virus. Having some of these best practices in mind in your day-to-day interactions are going to help protect you from that.
So one final question to each of you, and again, I want to thank you both for your time and enthusiasm and knowledge. Dr. Rizzo, you had a great question that just popped up, and that is with people with complex chronic conditions who may need to use the medical system for a non-COVID-19 situation. Any thoughts as the medical system becomes burdened?
Well, I think certainly, like I said before, preparing to have all your medications, being in close communication with your physician by phone, and then potentially even calling ahead to a site that you might be visiting, saying, that you're coming in with a non-respiratory issue, and they just want to take precautions. And I think they will be accommodating. Most emergency rooms now, if they have suspicious patients with COVID-19, are putting them in separate parts of the emergency room as soon as that can be identified. So I think the more communication occurs, the better off individuals will be.
Thank you, Dr. Bell. We've talked a lot about COVID-19 and the impact on people with chronic conditions and specific conditions, but any tips on people who may feel isolated during this pandemic, especially on how they can maintain good mental health as well as physical health?
That's an excellent question. I think a very important component that I tried to touch on a little bit when I was talking about keeping in mind the anxiety or worry that individuals may have. You know, I think many organizations, and I can comment specifically on the National Psoriasis Foundation, we have a number of resources available to assist individuals as they're, you know, going through even their day-to-day experience with their chronic disease. But in the context of COVID-19 right now and people being told to stay home, that can be even more pronounced. So I would suggest that organizations also consider those resources for our patient communities. You know, again, we have the technology available. So having, you know, webinars, having telephone conversations, social media, there's a number of things that can be leveraged in a very positive manner to help the community in those situations.
Again, I want to thank both Dr. Rizzo and Dr. Bell for all the great information and taking the time to spend with us. To all of you on the line, we will have this on our website as well as the slides that you saw, as well as additional information. I just want to thank you all for your commitment to people with chronic conditions. Please be informed and be safe.